Hello, welcome back to this video. If you are new to this channel, welcome, and if you are returning, I truly appreciate your presence. In this video, I will share with you 4 tips that you must remember when you are looking for your job as an attending physician. And this attending physician job could be in hospital medicine or it could be in any specialty after you complete your fellowship training. Hi, my name is Dr. Farzana Hoque. I'm an associate professor of medicine currently practicing in the US. As an international medical graduate, when I finished my residency training, when it was the time to transition my professional journey from the trainee or resident to the attending or board certified physician, there were a lot of questions came to my mind. However, most of the time they were not very easy to find out because nobody get trained about this how to excel at your first job in the residency training. So in this video, I will share with you 4 tips that I have learned over the years from my own professional journey as well as through mentoring lot of residents who are both American graduate as well as international medical graduates. So the number 1 tips is that before you start your attending physician job, make sure you are starting at least 8 months to 1 year ahead. I know it may sound long, but believe me, it's not long. Particularly if you are a resident who are on visa, it could be J1 visa or H1 visa. Make sure you are starting at least 1 year early because everything for the visa applicant needs to do a lot of work. So please do not keep it for last moment. And if you are an American graduates, for you as well, make sure you are at least starting 6 to 8 months ahead. Secondly, identify that which setting you want to work on. For example, if you just finished your residency, now this is the perfect timing to ask yourself, do you see yourself to work in inpatient setting or outpatient in the clinical? This is a crucial question. After you have this crucial question answered, then come another important question that is, okay, you want to work in a community hospital or big academic center? Because you know that there is a pay difference in community hospital versus academic big university hospital. There are a lot of things are different. And also, do you want to do mostly only the day shifts or do you want to do only the night shift or nocturnist? Or do you want a combination of both, like maybe majority of them day shift and some night shift? So identifying, asking yourself first about these questions will make your life much more easier as well as your job search very productive. The third tips is that research and research your program where you are going for interview. And now in this internet era, I know that you will agree with me. If you just Google of that hospital or university name, it will pop up immediately. Not only the websites, also maybe take a look at their Twitter page, Facebook, LinkedIn page. I will share that, okay, it is definitely important to research your program on the social media, no doubt. At the same time, we know that the image, what we get in the social media, may not always match 100% in the real life. So if you find a physician, a resident who is currently working in that hospital or in that program, in that university, try to connect with them. Or if you know somebody who maybe had any recent work experience. So the message is Besides researching that hospital or program where you are going for interview, it is also important to talk to the people who have first-hand experience of working there. And number 4 tips is that when you are going to interview, that is your prime opportunity to know about that program inside out, because all those crucial questions that I will share with you will make you successful from the first day of your job. Such as, ask them, okay, what is their call schedule? Because the call schedule, it varies significantly across the North America. Secondly, okay, do they have any backup system? For example, for many programs, there will be backup system where if any physician is getting sick or not able to come, that backup physician is supposed to jump in and do those shifts. The next question is that, okay, are those backup shifts paid, or will they be kind of included in that expected time frame per year? There will be other important questions to ask, such as what is their expectation of covering code? What is their expectation of covering rapid response? Are you expected to cover all of your rapid response? Do they have dedicated rapid response team? Because you will see there are many hospitals where you do not have to do your rapid response. It's not mandatory. If this is your patient, if you go, that's wonderful. However, many programs, they will have their dedicated rapid response or code team. And in contrast, for many programs, they do not have. So you will not know until you ask them. What about, do they have bonus structure? Do they have RVU? What is their way of having some initial training or some initial introduction of the program for the new physicians? I believe, all these questions like call structure, who is covering code, RVU structure, these are very, very important for a new graduates who will start the attending physician job. Even if you are maybe working for a couple of years, it will still remain important for you when you are starting any new job, regardless whether you are doing in academic setting or community setting, inpatient or outpatient. So if we summarize, the 4 tips you must know before starting your attending physician job is that first, make sure that you are starting early, giving yourself enough time. Second, make sure you know what you are looking for, because you have to choose between inpatient versus outpatient, community versus university. The third tips is always research your program, both through social media, websites, and also if you have any connections. And finally, ask all those important questions that I mentioned in this video to make sure you know all the important information to be successful from the very first day of your new job. I hope you will find this video helpful. Please like this video and subscribe to this channel, because your subscription is a great motivation for me to make more useful videos for you. I wish you all the best. If you have any tips, any questions, please make sure put it in the comments below, because I read them very carefully and make sure to reply them as well. I will see you in the next video, and until then, take care.